Ladies and gentlemen, I would like to introduce you Michael Stewart. And of course, Michael Stewart may sound as an ordinary name for an American, but Michael Stewart that is sitting next to me is not ordinary, especially to find him here in Sochi. That's one thing. And you are...
Well, thank you, Yuri. I'm an orthopedic surgeon, and I practice in the United States in Minnesota. I'm here because I'm the International Ice Hockey Federation Medical Supervisor. I also am the Chief Medical Officer for USA Hockey, and I serve as a team physician for USA Hockey National. Well, we came as a representative of the International Ice Hockey Federation for the Under-18 World Championships, because this is a test event for Sochi 2014. And we are here to observe the facilities and the medical equipment, and also meet the medical providers, the healthcare providers, the doctors and paramedics. And also we had a workshop where we discussed ice hockey injuries. We went out on the ice and practiced emergency evacuation and talked about the emergency action plan, which will be used for this tournament, but then also in February of 2014 when the world comes to Sochi. The word injury would be the same as trauma, so it's typically a mild or not a serious problem. Many of the trauma or injuries in ice hockey are a contusion or a bruise, or maybe a muscle injury called a strain or a pull. Sometimes at the professional level or at the junior level, where the players no longer wear a full face mask, we see lacerations or cuts to the skin, which require our medical care. Yeah, if we start from the head, the most concerning injury we have maybe in our sport right now is a concussion, which is a trauma to the brain. Well, typically that's from a blow to the head or a hit to the head, but it could also be a blow to the body where the head has what we call a whiplash effect, because the brain moves inside the skull. And there can be damage to the brain from contact, whether it's legal or sometimes illegal, like an elbow or a punch or a charging or boarding or some of the penalties that are involved in the sport. With facial protection, fortunately, for example, in this tournament with a full face mask, there's no risk of injury to the eye. With the visor or the partial face mask, there have been some eye injuries. It does protect the eye, but it does not mean the eye could not still be injured. Also, without facial protection, there are cuts or lacerations to the face, and oftentimes dental trauma, which would be a fracture of the teeth or to the lips or gums, etc. In the mouth area, or in the teeth to be specific, but it would probably be a puck to the face or puck to the mouth. And that's the importance of wearing a mouthpiece or mouth guard, which is an appliance which helps to protect the teeth and the structures in the mouth from sticks and pucks and other trauma. Yeah, the defenseman laid down on the ice in an attempt to block the shot, and unfortunately the puck hit him in the face. Struck him in the face.
So we have full face masks that the players under 18 wear, and then we have visors, and then we have no visor masks, right? So
yes, but in the Olympics, I think every player will likely be wearing a visor, because you have to be of a certain age to go without a visor at the Olympics. So the International Ice Hockey Federation rules now require a visor unless you were born prior to 1975. So now I think most of our players will be young enough that they will be required to wear a visor, which of course in the National Hockey League, they do not have that requirement. So you can choose not to wear a face mask or visor. Now we go to the neck or the cervical spine. The cervical spine are the vertebrae in the neck, which of course protect the spinal cord. So an injury to the neck, although very rare, can be serious, because a player sliding into the boards who strikes the top of their head could have a fracture or a subluxation or dislocation of the vertebrae, which can then cause spinal cord injury, and that results in paralysis Well, it could affect the central nervous system, which is obviously a very tragic injury, which we have seen in the sport of ice hockey.
But let's hope not very often, right?
It's a very rare injury, but we try our best to prevent it by teaching players not to go headfirst into the boards, trying to avoid those dangerous types of activities. C4, C3, that refers to the number of the cervical vertebrae. So the cervical vertebrae start, the first below the skull is called C1. 2, 3, 4, 5, 6, 7, 8. Shoulders are commonly injured in hockey because of the contact, again, with players or with the boards. Since the sport is played on ice, which makes it fast, but also with a rigid or very firm surface, not only the ice surface, but the perimeter surrounding the ice. And so collisions can cause injuries to ligaments around the shoulder or fractures of the bone around the shoulder. There can be injuries to the elbow, maybe not as common, but certainly to the wrist and the hand. Players do wear elbow pads and they wear hockey gloves, which afford protection, but the wrist can be pushed back and that can cause fractures or ligament injuries. Sometimes the stick, the slash, where players hit by a stick in the hand, can cause a fracture of the bones of the hand. The trunk would be that area between the neck and the hips. So the trunk injuries could include the chest or the abdomen or the spine, which is the thoracic spine, or lumbar spine. So the spine in the chest area, thoracic spine, the low back is the lumbar area. So you can have muscle injuries from overuse. You could take a puck or stick to the chest or to the abdomen. Again, very rare, but you could, for example, injure an organ of the abdomen like the spleen or some internal organ damage. Much more commonly in the abdomen is an injury to the muscle area because of the skating stride and very demanding type of sport for the muscles that flex the hip, bring the hip up and push out and return the leg with the skating stride. So we call it the hip flexor or groin or adductor injuries. And those are very common in hockey because of the skating.
The skating style, or maybe when the skater pushes and then he gets hit into his leg, and or
no, it's not so much from a acute event or one event. It's more from use, from so much skating. Those muscles or tendons could become injured. The thigh would be between the hip and the knee, and players do wear the hockey pants, which has some padding, but you could take a knee or a puck or a stick and you can get a bleeding into the muscles of the thigh called the quadriceps muscle, and that collection of blood is called a hematoma. So you can get a quadriceps or muscle bleeding, and we do see that in hockey players sometimes as well. A sprain, S-P-R-A-I-N, is injury to a ligament which connects bone to bone and provides stability for a joint. And a strain, S-T-R-A-I-N, is an injury to a muscle tendon unit. The muscle contracts and the tendon then, which is attached to the bone, allows movement. Well, there's a lot of contact in the sport of ice hockey. It could be from incidental contact, which means they ran into each other without a purpose of checking. It could just be a collision of players with each other or with the boards. Body checking is a specific skill where a player makes a collision happen to try to remove the opponent from the puck. So
get hold on.
To take control of the puck. So body checking requires that you can only hit from the front, not from behind. You cannot skate more than 3 strides before you hit someone. And it's an important part of the game in the men's game. There is no legal body checking at any level of women's hockey. So at the Shaiba Arena, where the women's Olympics will be held in Sochi, there is a lot of contact or collisions which can cause injuries, but there is no legal body checking. It's a penalty to purposely cause a collision to take the puck away from the other player.